Hi, everyone. On today's podcast, we're going to talk with Dr. Heather Maguire about moving on from birth to parenting infants and then toddlers. Hi, everyone. Today, I'm so excited to welcome Dr. Heather Maguire to the Evidence-Based Birth Podcast. Before we get started, I have a quick announcement to make, and that is that the Evidence-Based Birth Professional membership is now available for a free trial. So you can get a free 30-day trial, and that is available through July 14, next Tuesday. So if you are a professional in the childbirth or maternal health field and you'd like to try out our continuing education resources and earn some contact hours and try out our community and see what it's like, just go to evidencebasedbirth.com/membership and you will see there the coupon code to get a free 30-day trial. We have not offered this trial in several years, so we wanted to give people an opportunity who have been maybe thinking about the membership but weren't sure if they wanted to join, a chance to try us out for 30 days. So again, just go to evidencebasedbirth.com/membership. And with that, let's get to our interview with Dr. Heather Maguire. Heather is a board-certified behavior analyst-doctoral with a doctorate in educational psychology. Dr. Maguire has spent over a decade studying behavior and working with children, parents, and educators. She's a proud mom of 2 kids, a professor teaching school psychology courses, and the founder of Prism Behavior, which helps parents manage challenging behaviors with confidence. Dr. Maguire connects with parents on the Prism Behavior Podcasts and social media channels, and she is here today to talk with us about parenting infants and toddlers. So welcome, Dr. Maguire, to the Evidence-Based Birth Podcast.
Yeah, thanks so much for having me. I'm really excited to be on your show today, and I'm sure we're going to have great conversation because I love the idea of evidence-based really anything, probably because I'm a professor and a nerd myself.
Yeah, we have a lot of people who say they like to geek out on research who follow our podcast. So.
Yes.
All right. So Dr. Maguire, before we get into talking about parenting toddlers, and that's what I brought her on to talk about, because a lot of times parents, they picture having a birth, they picture having a baby, but they don't picture like moving on from that. And we're going to talk about that in a minute. But first, I wanted to hear about your own birth stories. Tell us a little bit about your pregnancy journey with your 2 children.
Yeah. So I have 2 kids and I've only had, to my knowledge, 2 pregnancies. So in that sense, I would say in general, my pregnancies were pretty standard, if you will, if there is a standard pregnancy. So I was sick in the beginning, and then in the middle of the pregnancy, I was no longer sick. And then I was able to deliver both of my kids vaginally, didn't end up having a C-section. In terms of some of the things that some of your listeners might resonate with, originally, like early on with my first, when I was pregnant with Landon, I considered giving birth in a birthing center. Like I did a bunch of research and I was like, I know that too much intervention, a lot of times that would cause potentially C-section, things like that. So my husband and I were excited and we went to this birthing center and it seemed like a really good fit. I met the people there, there was midwives and things like that. So I was all excited until I called my insurance company. And my insurance company basically told me that, in terms of, paying for all of this, that they would pay for 70% of whatever was fair and customary. They use some jargon like that. And I'm like, well, what if you guys think that only $200 is fair and customary? Like, how do I even know to make an informed decision about if I can afford to give birth in this birthing center? And I couldn't get a straight shot answer. So for me at that point, I just kind of, I think when I had my son, I was like, mid 20s-ish, right? So at that point, honestly, I was just frustrated. But at the same time, I just was like, you know what? I think I'm just going to give birth in a hospital and just do the quote unquote normal thing. And so actually for giving birth to Landon and Addie, I had a pretty smooth sailing birth. In both instances, I was only in the hospital for a few hours and, there was no like major incident. Like a few things were surprising to me. So for example, with my son, he was born like 10 days early, and I got to the hospital, and I was like, started going into labor, and I got to the hospital, and it was funny because the nurses kind of looked at me. They're like, "Oh, first pregnancy, huh?" They're like, sure you're in labor. Like they didn't believe me early on. But I was like, yeah, I think I'm in labor. And they're like, okay, well, we'll check you. And then, and we'll see, if you're dilated or not. And then we'll walk you around. If you don't make progress, we'll send you home. I think they just like assumed, because I kind of like waltzed in there, like, I think I'm having a baby. And so, sure enough, I, was in labor, and Landon was born, only a few hours later. I decided to get that epidural, and everything was okay. But here's one of the interesting things. After I had Landon, I was like, oh, and I didn't even, need Pitocin, right? Because I mean, honestly, I was like, he was born like 4 hours after we got to the hospital with, no complications. And they're like, no, we gave you Pitocin. So they never even asked, and I never even knew. So that was surprising to me. And then another surprising thing to me was actually with my daughter. So with her, so she was born on the East Coast. So I live in Southern California, and, my son was born in Newport Beach, and the hospital was a little bit more, with it in terms of like, they never took Landon from my room. It was a lot more like, parent centered. They had a lactation consultant actually come and visit me in the hospital. Like it was a, pretty positive thing. But with my daughter, so we were living on the East Coast when my daughter was born. And so she was born in Greenwich, Connecticut. And actually, I think I told you before we turned on our interview, I started, reading some of your book, which I really like, by the way. And, I really resonated with the part where you said that they took, your firstborn for a few hours, because I was literally shocked. The same thing happened to me, although I did after Addie was born, my daughter. And again, her delivery was pretty relatively quick, and, no major issues. But she was healthy, and I was happy, got to hold her for a little while. And then as soon as they were like moving me from the delivery room to the recovery room, they took her. And I'm like, what are you doing? Like, she's fine. I'm fine, And they're like, oh, So then I spent literally like the next like 2 to 3 hours, like asking them, like, when do I get my baby back? Can I have my baby? Like, finally, I just had to like put my foot down. Give me my baby, So I think like that was surprising to me. And I think if I would have kind of known that in advance, that was a potential thing that could happen, I would have been more prepared to kind of put my foot down. In terms of like the parts of my story that might resonate with your listeners, those are some of the things that I experienced.
Did they ever give you a reason for why they took your daughter away? Or was it just for routine procedures?
It just seemed like it was like routine procedures. And then they told me, like, oh, well, her temperature dropped a little bit, and we just wanted, and I was like, well, I think that it's pretty normal for the baby's temperature to drop a little bit after, you give birth. Like, can't I help keep her warm? And the only other thing was that, so both with my son and with my daughter, I only stayed in the hospital one night. I had been kind of prepped by a friend, like, you can leave the hospital pretty quickly after giving birth, but you have to kind of be pushy about it. So with my son, again, in Southern California, that was relatively easy, especially since there's, no issues. But then with my daughter on the East Coast, with her situation, I was like, okay, so I want to go home today. I think, she had been born the day prior. We spent one night in the hospital. Of course, you don't sleep well when you're in the hospital and people are checking you and all that. So the next day I was like, I want to go home. And they gave me such a hard time for not wanting to stay like the additional night in the hospital. You would have thought that like there was something wrong. And so I'm like, why shouldn't I go home? And they're like, oh, we just don't recommend it. They like acted like I was crazy, but I was like, I just gave birth. Like, some people give birth in their home. I said, I think I can go home. Yeah, that was another thing that, was a little bit surprising to me. Neither situation was, traumatic, and I'm very grateful, for that. But
well, I think you raise a good point in the geographic like variation of care, how it can differ from state to state, city to city, country to country. And even within the same city, you could have one hospital that's very progressive and another hospital that has different, really strict, outdated rules and policies. And I know that near me, it's really easy to go home early with your baby if you're both doing well in some facilities, but in other facilities, the pediatricians are so against it. that they like say you're quote not allowed to go home. And people feel like they're literally like, what do you mean I'm not allowed to go home? And you're right. It's, when people give birth at home and never leave their homes, it's kind of funny to think that people are kept in the hospital when they don't need to be. But then there's also the opposite where some people need to stay longer and they're not allowed to stay. So there's kind of that same issue with like not individualizing care, which sometimes happens in some places.
Yeah. I know I did see the big difference. And actually, when we were living on the East Coast, my husband had like a medical situation that happened as well. So I got to experience, again, I don't know if this was hospital specific, East Coast specific, like, because on the surface, both hospitals seemed very similar, Hoag Hospital and then the one in Greenwich, Connecticut, Hoag is in Newport. They seemed like they would be similar. What I felt at least was a little bit more of like an old school East Coast, approach. We do things because that is the way we do things. Although I don't know if that's an accurate take on, the hospital facilities in the different areas. But
how were your postpartum experiences with both children?
Yeah. So everybody's so different. I was very well aware of that postpartum depression or anxiety, things like that can happen. But I didn't experience that with either of my kids. However, what I did experience, and I don't think people really talked to me about this, and I didn't really even come to terms or realize it until after the fact, was that I had a bout of like mild depression while I was pregnant with both kids. And again, I thought I just don't like being pregnant or whatever. But as I kind of like look back, for me at least, as soon as my kids were born, kind of like a light switch went off. Like I loved being a new mom. Both of my kids slept pretty quickly. And so I think that makes a big difference. If you don't get enough sleep, I think that's very challenging. But yeah, for me, I just didn't like being pregnant. But then on top of that, I definitely had just kind of a general sense of some anxiety, but more just kind of some depressive symptoms while I was pregnant. And because everybody was, talks a lot about depression that can follow pregnancy rather than depression that can, occur during pregnancy. I didn't really pick up on it until kind of later on, looking back and reflecting.
Yeah. And that's a really great point for our listeners to remember, that actual technical term is perinatal depression, which includes the pregnancy and postpartum period. And it's almost just as common to have depression during pregnancy as it is to have it postpartum. And so it's important, to be screened for depression while you're pregnant, just as important as if you're being screened postpartum. And most people don't realize that.
Yeah. Definitely.
So tell me then, what led you to spend 10 years of your life or more studying behavior and working with children? Did you become interested in that before you had children of your own, or was that spurred on by your own parenting experiences?
Yeah, so I had my son during my doctoral program. And, it was during, my master's is also in educational psychology. So I became, a school psychologist. Although I didn't practice very long as a school psychologist, I quickly went in to do like in-home behavioral therapy before I had kids. And honestly, I kind of fell into it a little bit because one of my former professors had a business doing in-home behavioral therapy. And, I was starting to realize that I wanted to work a little bit more actually like with kids than, school psychologists, even though they, do testing. So for your listeners who might not know, school psychologists, they do a little bit of counseling and whatnot, but like their major function in the school system is to do assessment to determine if kids qualify for special education services. And so, rather than working with kids on a continuous basis, it's kind of like you're doing testing and report writing and meetings a lot, right? And so I wanted to connect a little bit more with kids. And so, doing in-home behavioral therapy, I was working primarily with kids with autism and their families. And so that just became intriguing to me. So actually, even though like my degree, both a master's and doctorate is in educational psychology, I started taking classes on the side. I don't know, I was crazy, to become a certified behavior analyst as well, which was complementary, but they were like separate classes. Yeah. So I just really started to enjoy understanding like why behavior happens and what parents and teachers as well can do to create an environment where you're going to see more behaviors that help the child and less of those behaviors that, are harmful to others and the child, right? And so I started to enjoy that. And then kind of like fast forward. So I did that for a while. I started to realize that a lot of what I was doing for kids with autism, so that was primarily paid for by insurance, right? And there's a big need there for sure. But what I started to realize is that for the average parent, there isn't access to a behavior analyst like myself. You have to have a diagnosis of autism usually to get those types of services. But, a lot of what's out there, whether it be the internet, books, things like that, it's just kind of like people's opinion about how you should parent. But not a lot of it is actually based upon research, right? And so all I was doing with the kids with, autism and their families, a lot of the same principles and practices, can be used by kind of the quote unquote everyday parent, let's say, who's struggling with more like mild to moderate behavior issues. That's what I was realizing is kind of like what the need was. And so that's why I started to, my Prism Parenting podcast and whatnot, because I wanted to kind of start to try to meet that need for kind of your like, let's say parent of maybe a child has ADHD, or maybe they're just having some issues, mild behavior issues at home.
So your Prism Behavior podcast and blog and everything could apply to parents with children with autism or ADHD, but also maybe parents with like spirited children.
Yeah.
Children with behavior issues where you're not sure as the parent what to do.
Yeah. So actually that's the focus even, because again, like if you have a child with, let's say a diagnosis like autism, you have a whole host of resources, right? But, in terms of, like your everyday parent, again, there's just a lot of false information out there about, what you can do as a parent to positively influence the behavior of your kids. Like there's just a lot of stuff out there that's not true.
Yeah. Can you give us some examples of like some bad parenting advice you see online?
Okay, so one of the things that people like to talk about, so positive parenting is a trend. And I think like I agree with a lot of it, right? So it's basically the idea that, people are so much inclined to, overuse of discipline and punishment is the case, which I agree with that part. But basically kind of the trend is like, don't punish your kids at all. And so that's not necessarily, I don't think, helpful to everyday parenting. So, for example, I think that about 80% of your effort should be putting things into place that are proactive, right? So I talk a little bit more later about reward systems, for example. It's, catching your child doing the right things and, rewarding them and motivating them with that. Like that should be about 80% of your effort. But at the same time, sometimes kids still act out despite our, best intentions. And so parents also need information about, how to discipline effectively without, immediately going to, let's say, spanking, for example. What are alternatives to spanking? Because if you only say the positives and you don't give like ideas for parents for discipline, then they're just going to kind of go with maybe the way that they were raised or, whatnot. And a lot of times, they're going to go to those harsh punishments. So if you don't incorporate like punishment at all into, your parenting philosophy, it's probably going to be hard for you. Okay. So that's kind of an example of one of the things out there that I disagree with, if you will.
So you're saying that there's some research-based information about how using consequences can, in terms of discipline, should be part of a parenting strategy.
Yeah.
So, and I don't want to jump the gun here, but one of the reasons I wanted to bring you on is because I know this happened to me, and I'm sure it happens to other parents. But when I was pregnant, I literally only imagined having a baby. And I did not imagine having a toddler, preschooler, school-age child, or teenager. And all I pictured was caring for a baby who I would hold and, feed and cuddle with. And even though I'd been around children my whole life, it just never occurred to me that one day, this little being would start screaming at me or,
right.
doing some, like kicking on the floor. I remember when my first child had their first temper tantrum. It was a little before the age of 1. And she just started screaming. And then she lay down on the floor and was just kicking and punching the air and screaming. And I thought she was sick because I had never seen her do that before. And I was like, is she sick? Is she okay? Like, what's going on? But it was just a behavior, she was turning into a toddler. Right. So I was wondering if you could talk a little bit about that transition. A lot of people who are listening right now might be pregnant or they've had a baby and they're starting to enter those toddler years. Can you talk about like transitioning from parenting an infant to parenting a toddler?
Yeah. So our kids are always keeping us on our toes. And, what works today might not work tomorrow. So don't be discouraged and don't be afraid to innovate. Okay. But I think that specifically talking about that transition from like the infant baby to, let's say, toddlers who are starting to tantrum, one thing to keep in mind is that kind of our inclination when a child tantrums, our child tantrums in front of us is to try to talk to them like an adult, almost like, what's wrong? And we use a lot of words and we like, but what happens when we do that is we like inadvertently give a lot of attention to their behavior. And when you give a kiddo like who's tantruming a lot of attention, even if the attention might even be like a reprimand, like, don't do that. You're not allowed to do that. A lot of times what you'll start to see is that the child, you wouldn't think so because you might think you're disciplining your child, for example, but the child will start to tantrum more often in those situations. So a lot of times what I would suggest for young kids is that you might actually, instead of being like, why are you crying and what are you doing and you need to get up, whatever, one of kind of the easiest things that you can do with a child who's that age is what's called like ignore and redirect. So rather than like, not ignore them, but like provide a lot of attention for what they're doing, but try to engage them in something else. Like, basically, find something else that they could potentially get interested in and start playing with it. And kind of, a lot of times in that situation, kids, their attention span is pretty short. They're going to kind of drift their attention away and stop their tantrum. So that's like at least initially one of the strategies that you can use with a child who, let's say, is all of a sudden starting to tantrum. But another thing to think about is this. So if your child is starting to tantrum a lot, like on a frequent basis, you're trying what I'm saying and it's not working, even with young kids, it is okay, even though you might not start with this, it is okay to give young kids timeouts. It's just that it looks a little bit different. So if your 1-year-old is tantruming, you're not going to be like, sit on the timeout chair. You're not going to be able to explain like what a timeout is to a 1-year-old. But the interesting thing about timeout is that it's effective, even if you use it correctly, even if you don't understand why it's effective. Like your child doesn't have to understand that they're even on timeout. So you can use a really simple technique where, like, let's say you have like portable crib or pack and play, whatnot. And, if you have an issue that's continuing to happen, whether it's a tantrum or it's like pulling out cords from the walls. Like I remember, I think I used timeout first with my kids when they were like, wouldn't stop touching the cords. And first I kept on trying to take them away from the cords, and engage them in something else, but they just kept touching the cords, right? So, having like a pack and play. And then if your child's like 1, setting a timer for a minute, procedure might look like this. If they touch the cord, you might give them like 2 or 3 words like no touch, and then putting them in the pack and play, a safe environment. Okay. Set a timer for a minute and then move on. So just that procedure right there, like the kiddo can be too young to understand language, they're going to maybe understand your facial expressions a little bit, but just by removing them from the environment to a less preferred environment for a minute can be effective timeout for, like, let's say a young child who is habitually, engaging in some sort of problem behavior on a regular basis, if that makes sense.
Yeah. Can you talk also a little bit about some other challenging behaviors you see in, babies that are transitioning to the toddler stage?
Yeah. So one of the things I see with like young kids that you'll see a lot, maybe their first problem behavior before tantrums start or whatnot, is you might see a situation where kids are pulling their mom's hair or pinching, and parents, a lot of times they don't know like, how do I respond to that? And so they'll say a lot of times they'll be like, they'll tell that, their little baby, like, no, don't do that. No, no. But what they'll find is that it increases a lot. So in those situations, what I would typically suggest is that somehow like change that environment rather than constantly telling them no, no, no. Like if you find that your child is pulling your hair, doing simple things like putting your hair back, right? Or so that they can't touch it, or facing your child out. Let's say when you're holding them, and if saying no isn't working, because again, kids they don't know how to properly obtain your attention always at that young of an age. So doing simple things like that is effective for like really young kids who are starting to kind of experiment with some of those behaviors that they don't fully understand, but maybe are starting to have, some sort of negative or maladaptive behaviors.
You think sometimes they're doing these behaviors purposefully for a reaction, like once they realize that it gets a reaction out of you?
Yeah. Like the first time they do it, probably not. They're just kind of experimenting. But kids at this age, they learn primarily through like cause and effect, right? And so the first time they pinch you, it might just be kind of an accident. But then you're like, oh, and then they're like, wow, you're just like my new cause and effect toy. So I do this and you do that, So they're just kind of learning that cause and effect, right? And so if you don't give them the effect, then they'll move it to a different thing to get your attention. So hopefully there's things that they can do like, the types of things you want them to do, like making kissing faces and smiling at you and things like that. And hopefully that gets, your attention in a much more positive way versus like, let's say, pinching you.
So do you have any advice for parents, as they're like moving through the different stages and transitions of parenting, transitioning from a newborn to a baby who's crawling and getting into things to a baby who's walking and climbing and getting into trouble and having challenges in the toddler period? Do you have any advice for how parents can like thrive or at least survive during those transitions?
Yeah. So I think anything that you can do in terms of the environment to set yourself up for success. A lot of times we find ourselves as parents constantly in this kind of like reactive mode, and it's because like we're tired and life is busy and things like that. But like, let's say, I always say, I always make a joke that 18 months is my least favorite age of parenting. Like there's lots of fun things about 18-month-olds, but they're just kind of hard, right? They're not communicating very much yet. They're kind of dangerous, right? Like you have to make sure that they're safe, but they walk and they're all over the place. So I would say like whatever you can do in terms of your home environment, like I'm a big fan of baby proofing, for example, because I think that, if there's things that you can do to set your environment up so that you're not constantly feeling that mode of frustration. Unfortunately, I think as parents, a lot of times rather than, doing the proactive things, we get caught in kind of that reactive mode. And unfortunately, it ends up spending a lot more energy in that reactive mode. And it's not as positive of a situation. But if we can, do sometimes it's just small things to set ourselves up for success, it can be helpful. As kids are getting older, let's say like the preschool age, I think that, so for example, I have a son, Landon. He's a sweetheart. He's 9 now. He just turned 9. And Landon has ADHD. And, he's a sweet kid, but, he's a spirited kid. Like we've always had some behavior challenges with him. And so pretty early on, I started to adopt like a reward system with him. And it's kind of like changed over time, right? Initially with young kids, you can have more of like, first do this, then you can have this. So just by like placing events in certain orders, if you place like a non-preferred event like cleaning your room or making, whatever, and then do something fun right after it, whether it's go to the park or screen time or whatever, we're going to see like kids are much more likely to do those things that they don't like doing if they have something fun that follows it, if, that creates a sense of motivation, if you will. So that, and then, once he was a little bit older, kind of moving on to like those charts where he, like a very simple like star chart, right? Where there's different ways you can use star charts. If you find that your kiddo is having like a lot of tantrums during the day, right? Then maybe what you do is like, okay, if you don't have a tantrum between now and snack time, then you earn a star, And so it's like breaking the day into small chunks and then like kind of celebrating that success. And then ultimately, once they get a certain amount of stars, then it doesn't have to be like something huge. Like I always tell parents to kind of avoid the Disneyland type of prizes of like, do all these things and then you can go to Disneyland, for example. Because once you've offered this like huge reward, then it's kind of hard to compete with that. But really, it could just be small things, whether it's like small, like, snacks that they prefer and they only get if they've earned them, or maybe watching a show. Or I've even had parents like they like put a small box of toys that are highly preferred, but like the kids only have access to them when they've earned it with their stars, for example. And so by keeping those items, up high where the kids can't get them, then the kids aren't sick of those toys. Those are like their special toys. That can be a good way to use like a reward system with the kids, who are in preschool. And then as kids are getting older, you might even start to use like a quarter system where kids earn quarters, let's say, for certain behaviors that they're working on, whether it's like doing their homework without complaining or getting ready for the day on time or whatnot. But I mean, really, the research shows that, using like motivation reward systems is like the number one way to get the positive outcome you want with your kids' behaviors. Like that's like the key. It's what we call positive reinforcement, or, using like rewards and motivations with kids.
Yeah, I remember speaking with the therapist one time who was telling me that, she called that tactic motivating the unmotivated. She's like, you have to figure out a way to motivate those who are not motivated, and figuring out what rewards are so compelling to them that they are willing to have positive behaviors. And then eventually it just becomes a habit, the positive behaviors, correct?
Correct. And as the parent, you're always like thinking to that next step. So, I mean, for example, I think about, it could just be like your average day. And like maybe, for example, my kids are like, oh, Mom, can we go do X? And I'm like, sure. But then I'm going to think to myself, okay, I know that they just literally told me that that's what they want. So I also know that as part of their, routine today, they need to clean their room. That needs to get done. And we might have, one or two other things we need to do. So I'm going to be strategic. I'm not going to be like, sure, let's go do that fun thing you just asked first, right? I'm going to be like, sure, let's do that. But here's what you need to do first. And then what you'll see is like, oh, okay. And, suddenly something that might take your child a long time to complete and they might complain about, all of a sudden they're like, oh, well, I better get it done quickly because I want to, so as parents, always being kind of strategic about what types of things like that, like what order that we should encourage our kids to do certain things in, and kind of just taking advantage of like the things that are naturally, happening in your environment, if that makes sense.
Yeah, I agree. Like, found that strategy to be really helpful in our house, to having things that the kids want to do. I mean, even when we were potty training, it's like, we'll go to the park as soon as you go potty, and my kids have always loved taking a bath. So you can have a bath with bubbles, like as soon as you do this. So doing the order like that definitely helps. I wanted to ask you about parenting while you're pregnant. So for our listeners who are pregnant, I know a lot of our pregnant listeners already have children at home. And I'm just curious if you have any suggestions for how you can continue to parent toddlers and small children when you're feeling exhausted or nauseous or having morning sickness or other health difficulties during pregnancy. For example, I know I write about this in my book, Babies Are Not Pizzas, but I had terrible migraines with each of my pregnancies. And the first one, it was awful, but I didn't have any children to take care of. But by the second and third time, it really threw me for a loop. Like, how do I continue to parent when I'm so sick?
Yeah. So here's the deal. Like, I think a few things come to mind when I think about that. First of all, again, these things happen. They're a season of time. I think a lot of times we get into this funk of being like, oh, well, I need to be working with my child on their pre-academic skills. And got to have only X amount of screen time. And we get like laser focused, and all those things, they're good in and of themselves. But I'm sorry, like if you're pregnant and nauseous and vomiting, you're probably not going to be able to accomplish all those things that maybe you would be able to do, or what you would hope you would be able to do if you were feeling great. And so first, I think it's just kind of like accepting that this is a season, and your child's like well-being and how they're being raised, it's not going to be solely impacted by this one season. So if you do have to take a break from, doing those, like maybe there's certain things that you want to be teaching your child and working with your child on, it's kind of just giving yourself permission to kind of put some of that stuff on the back burner and kind of go into survival mode a little bit. Like if, your child does have to watch screens for a little bit more because you're, struggling, that's okay. And then I think too, it's finding that village of people who can support you. For your listeners who have family and friends that are available, it's actually, relying on them while you're going through those hard times. It's asking for help. A lot of times people want to help, but we are afraid to ask them. And then, we just kind of trudge through, being a parent, being a mom specifically by ourselves, and it's not helpful. So I think it's connecting with the people you have. And if you don't have your village right now, there's so many different ways to get connected with different parents as well. So it's like finding that group. So for me, there's something called MOPS, Moms of Preschoolers, that was connected with like a local church in the area. So I attended that, and those moms were super helpful. And whenever I needed it, whether it's like I wasn't feeling well, and so one of them would bring me a meal, or, one of them would offer to take care of one of my kids for a few hours or whatnot. It's, I was able to find people like that through, whether you go to like meetup groups or whatnot, but it's just using the resources you have to kind of ask for that help. And then again, just kind of realizing that it's just a season and kind of giving yourself permission. You're not going to like spoil your kid forever if they watch a little bit too much screens in this exact moment, if that makes sense.
Yeah. So basically you're saying like, be gentle on yourself, give yourself some grace. Don't, feel guilty. Is what you're saying? If you can't do that 100% parenting thing that you want to be doing.
Yeah. One of the things I would suggest, and this kind of fits in, to when you're pregnant, kind of also fits in actually to when your kids are sick. Sometimes we aren't as able to follow through when we tell our kids to do something. So when kids are sick, we might ask them to do something and they're sick and they can't do it. Or if we're, let's say, pregnant, we might ask our kids to do something and we can't follow through because we don't have the energy. So it's kind of recognizing that you should be mindful of what you're asking of your kids. So for example, like if my kids were sick, I wouldn't be like, okay, my son has Legos all over his floor. I wouldn't be like, Landon, you need to clean your room. And then he would be like, oh, but I'm sick. And, might throw a tantrum. And I might be like, okay, you don't have to clean your room. I'm trying to prevent things like that, right? Because so, if I would have realized, okay, probably I should ask less of him because he's sick. Or in this instance of like me, if I was pregnant, realizing, okay, I am not really able to kind of follow through. So I'm not going to ask as much of my kids. I'm going to maybe for a short period of time, I'm going to be like, okay, it's actually probably in this moment easier for me to clean up his toys than to ask him to do it. And I'd rather follow, if I'm going to ask him to do something, I'd rather follow through with it. Just setting yourself up for success. That's another strategy that you can use. We're more likely to comply with, as people, things that are easier. And so your kids are less likely to act out if you're not putting too much on their plate.
So you want to have smaller requests for them.
Yeah.
For chores and that sort of thing that are easier for you to follow up on.
Yeah.
Do you have any other advice for parents who are facing these kinds of transition? Any final words of wisdom?
Yeah. So if you go to prismbehavior.com/free guide, your listeners can actually download this guide that talks about how you can use reward systems and motivation systems with kids of different ages. So from the kids who are, let's say who are young, who are maybe more toddler age up through elementary years, I think that, reward systems are, the key to a more peaceful home. So your listeners can download that. And I think that would be really, if I was to give like one piece of advice or whatnot in terms of what can make the biggest impact, I would say start there.
Yeah. And I really resonate with a lot of the strategies you've mentioned. And it's really reassuring because working with a therapist for one of our children who had anxiety issues, a lot of the behavior strategies you've suggested, so just this, coming up with positive rewards, ordering events, and also having natural consequences were exactly what our therapist recommended for anxiety, which a lot of people don't realize that, anxiety levels are really high among children today. We don't know exactly why, but these behavior strategies actually, as the parent, made the biggest difference in our child's anxiety, which was kind of a cool experience to experience firsthand how effective, like the positive reward systems and the consequences and ignoring behaviors, all these things that you're talking about were exactly what our therapists worked with us on.
Awesome.
And so, super excited to see your guide and encourage everybody to download that and get some ideas. So believe it or not, Heather and I recorded this interview before the pandemic hit the United States. And so I reached back out to Dr. Maguire and asked if she had any tips for parenting during the pandemic as we are getting deeper into what may be a year-long or more process of getting through this global pandemic. And so Heather reached back with a recording with a few parenting tips for us.
I definitely think that we are parenting in a challenging time. And, I think that there is no one size fits all approach. There are so many different dynamics. So in some homes, parents have lost jobs. In other homes, parents are, essential workers. They've been working the whole time. So there's so many different things going on. But if I were to say, kind of some overarching points as to, some helpful things that parents can be doing and thinking about during this time, I have a few. I think first of all, asking a lot of open-ended questions about, how all these changes are impacting our kids and how they're making them feel. Like, how do you feel about this? How did you feel today? What are you thinking about? Those open-ended questions are very important. And, coronavirus has been going on for a while now. And so perhaps for some of us, we've stopped asking some of these questions. But I think that it's important that these questions are ongoing. And then sometimes when we ask our kids questions, we try to kind of like talk our kids out of how they're feeling. And I think it's really important for us to affirm however they're feeling. And so, it's not to say that we might try to it's good to comfort them and, give them some guidance as well. But I think affirming our kids' feelings is really important. So, for example, if your son tells you that he's sad, you can say things like, it's okay to feel sad. Can I give you a hug? What are you feeling sad about? And then try to address those things. That's fine, but definitely acknowledge, and affirm how your kids are feeling and try to ask them on a consistent basis. I would definitely do that. Another thing I think that can be helpful right now is, something I told my kids from early on. All of us parents, we're just trying to understand and figure out how to act right now. There's no manual on, parenting during COVID, although, I suppose people have written them now in the last 3 months, but, nobody's going to have the exact same interpretation about the best way to parent. And so one of the things, I told my kids from the get-go was like, whatever decisions, our family makes, other people might make different decisions, and that's okay. It's not that I'm right and they're wrong or whatever. It's more that we're all doing the best that we can. So, they may have friends, for example, who at this point can spend, time with other kids. And, maybe they're not letting their kids spend time with other kids unless they, are family members or whatever, but different people are kind of interpreting things in different ways and, making decisions, and that's okay. And some parents, for example, may have their kids wear masks outside, and other parents may only have their kids wear masks, when they're inside, like an establishment. And so there's not a I would say agreed upon method for dealing with this. And so, kind of allowing your kids to know that will help, especially for those of us who have kids who are rule followers, who may feel a little bit frustrated that other kids have different rules for them. And then kind of the last thing, in all of this, there is a lack of normalcy and a lack of structure that is kind of bound to happen. Before there was probably more likely like a lot more structure in our homes and structured activities and things like that. And so that's okay to some extent. But I think that, whatever way we can kind of bring back some of that structure, I think that can be a very positive thing. In our home, what we've done is we've written down a schedule, kind of established a routine, and I actually chose to write it down. And I mean, I think I mentioned this earlier, it's writing down schedules is something that I do usually, okay? But especially now where everything is chaotic, it has helped my kids kind of understand what the day is going to look like. And then on top of that, if I allow my kids, and I have, I allow them to help create the schedule, then they're going to kind of feel that sense of control. It gives them back some of that control. So I think that can be helpful. And, maybe for you, it's just like a cadence of the day, or, some of the people who are listening, you might not need to, let's say, write down a schedule, but perhaps, just by establishing like at the beginning of every day, here's what we're doing today. What are the things you want to do today? That might be enough. So anyways, those are just some things I think that are particularly helpful as we navigate through parenting in this challenging time, but definitely not a comprehensive list.
I'm so thankful to Dr. Maguire for sending us that little recording with a few tips for talking with your children about the virus. And also, I wanted to mention that there are a lot of great resources out there for talking to kids about racism. Too often, white parents don't talk enough about racism and inequities with their children. I've been having conversations with my children about unconscious bias as well as systemic racism. And as hard as it is my responsibility to do that. I will link in the show notes to a few resources for talking with children about racism, both for white parents and for parents who are Black or persons of color. I also wanted to mention that Dr. Heather Maguire has 2 recent podcast episodes about talking with your children about race and racism. If you go to the Prism Parenting Podcast on your podcast app, it's episodes 55 and 56. And I also want to highly recommend the social media page called Social Justice Parenting with Dr. Tracy Baxley. You can find that on Instagram at Social Justice Parenting. Dr. Baxley has a new course for moms who want to be allies all about talking to your kids about racism. So I'd encourage you to follow the Social Justice Parenting page on Instagram and click on the link in Dr. Tracy Baxley's bio to see the many resources that she has there, including that upcoming course. Heather, thank you so much for coming on the podcast. And can you tell people again exactly how they can find you?
Yeah, so my podcast is Prism Parenting. And then as you can get that on any podcast platform. And then my website is prismbehavior.com. So Prism Behavior is the website and Prism Parenting is the podcast. And they can find me at Prism Behavior on Instagram. And then also if they have any questions related to parenting, I always email people back. So if this has, spurred any questions, they can email me directly at heather@prismbehavior.com, PRISM behavior.com.
So thanks so much again, Dr. Maguire, for coming on the podcast.
Yeah, I had a lot of fun today. Thank you so much for having me. I really hope that this conversation is helpful and valuable to your listeners.
All right, everyone. Thanks so much for listening. Don't forget that we have that free 30-day trial to the evidence-based birth professional membership for professionals in the childbirth or maternal health field. Just go to ebirth.com/membership to sign up for your free trial today. Thanks, and I'll talk with you all next week. Bye.